Well, hello everyone. This is Dr. Amigues, your friendly rheumatologist. It's such a pleasure to see you. I'm putting everything live. We're all good. So today we're going to talk about, I think, one of the most fascinating topics in rheumatology, and one that actually very few physicians understand very well. And this is where I'm very, very glad that I was trained in France and especially in Paris, in a service in a department that was one of the European Center of Excellence for Auto-Inflammatory syndrome. And to go through this, I'm going to share a little bit some cases just so that you understand what we're talking about. Okay, so recently, I had a patient who came with joint pain that was clearly inflammatory, worse in the morning, associated with morning stiffness and some swelling. But he also was complaining of abdominal pain that was recurrent, fevers that were recurrent, and a rash that was also recurrent. And when we digged a little bit deeper, it turns out that his dad had been diagnosed with rheumatoid arthritis, but really he had exactly the same symptoms. So the episodes of joint pain, abdominal pain, fevers, not feeling well were cyclic. So it's like severe pain, everything is not doing well, and then poof, get some, like, so apparently he was taking a steroid, so it would take like prednisone, and then it would actually feel better. And then same thing. And basically, we made a diagnosis of auto-inflammatory syndrome in this patient, started him on treatment, he's doing perfect, right? Remember, if you follow the lives, I have explained in the past that one of the way that one important thing that you need to achieve remission of a rheumatologic disorder is that you have to have the proper diagnosis. And this is one where some physician may say, oh, this is rheumatoid arthritis or this is gout or whatever, right? And the issue is that that's not exactly it. So it might actually respond. But if you don't really understand what it is, if it continues to flare, you're constantly not really understanding what's going on. So we're gonna talk about this. And so just basically what you need to know is, and if it's something that you're wondering, you may have, or someone that you know may have, is people who are going to have cyclic flare. So what I mean by that is that when they have a flare, it's kind of like all of those symptoms all together. Fever, abdominal pain, joint pain, rashes, that's the most common, but it can also be like pleural effusion, so shortness of breath, chest pain, hair loss. That hair loss, not so much hair loss, but it can happen. But so that's those are the things. And then you would do blood work, and during those time, you would see that there is elevated markers of the inflammation. But if you don't check the markers at that time, you may not see it at that, in between those episodes. So what is an auto-inflammatory syndrome? So auto-inflammatory syndrome, they look like there is an infection, right? Like if you really listen to this, you're like, oh, there's fever, there's joint pain, there's rash. Wait, isn't that an infection? So that could be an infection, except that you never find an infectious agent, and except that people actually do better with steroids, right? And so that is the main thing, is that, and I say this often, this is your way of your body to heal, is to actually create inflammation, right? And so there is this balance between I'm creating the inflammation and I'm, making sure that there's not enough inflammation, right? So you're constantly in like back and forth. Inflammation to heal, but making sure that there's no more inflammation once it's healed and, after healing, because that is important. That's how we heal. And when you have an infection, you're creating a lot of cytokine to battle the infection. And in this case, it is actually a battle where you're trying to get to remove them, right? Like you're removing the infection by creating inflammation. Well, in auto-inflammatory syndrome, auto is you, like ourselves, we are making inflammation. So we're creating inflammation that leads that leads to basically those symptoms. So even though you don't have an infectious agent, you're creating this inflammatory cycle. And it's actually considered genetic. It is genetic in the vast majority of cases, which is why you have to understand, like, and ask if there is family history, other family history of symptoms that are very similar. And I can tell you, it's actually pretty cool when you see that, because it's like, oh yes, my mom used to have this, or my dad used to have that, or my brother has that, my sister has that, or my son or daughter, they have like the same thing. And it might be at different levels. So someone has very mild symptoms, someone has severe symptoms, right? So that's what it is. It's basically on the genetic marker, like genetic make that you are. There is genetic changes, like some changes that are leading to this inflammation. And before thinking that this is bad, just realize that our bodies are made to reproduce, and in the long term, we want more of us, right? And that's what nature is about. And probably at one point, having those genetic variants was helpful in nature, right? So maybe there was a lot more infection, and you wanted to be able to go against an infectious agent in a better way, right? So it doesn't mean that this has never been helpful. The issue is that nowadays this is potentially an issue because we don't have as many infectious agents, and we don't want as much inflammation. Okay, so that's that. There are a couple of diseases that are, I'm going to give you a couple of names, but basically the way we do that, like, so if something is cyclic, there is inflammation, there is, and you're like, there is fever. This one is important. But if you have abdominal pain and those, basically our first thing is to think of, when we first think of it, is to basically get a genetic testing. And the genetic testing are going to actually look at all of, like, a panel of auto-inflammatory syndrome. Some of the more known ones are TRAPS, so TNF receptor associated periodic syndrome. These are like very fancy names, right? But TRAPS, we have a family Mediterranean fever. So TRAPS would be more in Caucasian, like, more like the north of Europe. So if your family is coming from Sweden, Norway, Germany, this is more like where we would see the TRAPS. But if your family is coming from Morocco, from south of France, from Italy, from Greece, Turkey, we're gonna Morocco, Algeria, all of those, like, north of Africa. This is more the family Mediterranean fever. Okay. And what you're going to tell me is they're going to be like, well, it doesn't sound like a big deal. Maybe there's not that much, like if in between you just live through and you don't have any inflammation in between, you'll be like, oh yeah, not a big deal. But actually it is a big deal, because if you have too much inflammation and you don't want to just live through this, this chronic ongoing too much inflammation can actually create deposit of a protein called amyloid. And this amyloid protein can actually cause kidney failure, heart failure. And usually, okay, so this is a while ago, but I did see that when I was back in France. The issue is people who have this and don't take care of it, or maybe because there was no treatment at the time, but now we do, right? Well, they would actually develop heart failure, renal failure, and it would be because of this amyloid. And the problem is that you can't really go back once you have that. So it's really a matter of preventing, right? And the way we prevent this is with treatment. So the first step is colchicine. Like in gout, yes, you're right, because it stops the inflammasome. The second step would be to try, potentially methotrexate, things like that. I don't think it works that well. You do not want to put colchicine and methotrexate together. No good, because that will cause problem. And then we have the biologics. So the IL-1 inhibitor, the TNF inhibitor, and the IL-6 inhibitor. Again, because you're stopping the inflammation. And I really wonder if the vagus nerve stimulation actually could help. I think it does help. I don't know that it would help with the most severe form, but I definitely think it would help with the forms that are not severe, so that you can prevent flares, and so that you can, prevent this like ongoing like amount of inflammatory markers and too much inflammation, and so you can prevent that and make sure that we don't have enough of that, and maybe there's not some of those flares, because really those cyclic, we don't actually know why they happen. We do not know yet why they happen, why you're fine for some days and then boom, you're having a flare, and then fine for some days and then boom, you're having a flare. We do not know what's causing that. And I'm sure in the next 10 years we will, but for now we don't. So one of the hypotheses is like maybe some infectious agent puts you towards the tip you over. Is it because of stress that tips you over? And so that actually, calls for parasympathetic, so vagus nerve stimulation. And it doesn't actually have to be a device, right? You can do this with techniques that are well researched now. And by the way, this is a plugin for the webinar that I'm going to do very soon. We're finalizing this, but it's going to be in the next 2 weeks. So please watch out and come on the webinar. I think you will all love it. So all in all, what you need to know is if you have cyclic symptoms, that they keep coming back and that there is fever more than you would expect. Second, that you have a genetic component. So your mom, your dad, your son, your daughter, or anything like this, or like brothers, sisters have some of those symptoms. And that you have episode where you're really severe, but in between you are absolutely fine. If you are having any of those symptoms, think of autoinflammatory syndrome and ask your physician to get the genetic test, because it's pretty easy to get that. And then ask them, if you are on no treatment, ask them for colchicine. Okay, that would be the first. If you do this, you'll do that would already be a lot for you. Okay, but this is a diagnosis that we don't think about. It's rare. And I think that there's a lot more people who have this that would know. Okay. Anyway, such a pleasure as always to see you. I see some of you are live. Al Sharanja. Thank you, Asan Raja. I do not need medical billing service because we are out of the insurance system. We take care of our patients through the insurance system, but I'm out myself. The practice itself is self-pay. It's much more than a rheumatology practice. Hi, Shana. Hi, Rita. Hi, Houston Community Surgical Center. And I had someone else here, but I don't see them anymore. But it's always a pleasure to see you and to serve you. Look at the webinar. I think you will get a lot from it. And I'm really excited about it. It's almost like as if 30 years of practicing medicine, 30 years of being a physician is leading me to this webinar and this course that I'm doing. So super, super excited to put this in the world. This is me being pregnant with it, and I'm very excited for the baby that it's going to become and grow. Okay, take good care. See you next week. Bye bye.